Today I'm going to be talking to you about a transcutaneous electrical nerve stimulator, also known as a TENS unit. So a TENS unit sends electrical impulses through a targeted portion of a patient's body in order to dull pain. This could be chronic pain from a spinal injury, a joint muscle pain, or it can be from a recent operation. TENS units are sometimes used by healthcare professionals and applied to patients. However, most of the time they are given to patients to take home to operate themselves. TENS units are typically risk-free. However, there are a couple risks that are always present when using electricity, such as you do not want to use the electrodes of the TENS unit across your heart. You also do not want to place them on either side of your brain, nor do you want to use a TENS unit near water, or if you have a pacemaker, you want to avoid using a TENS machine, as this can have severe side effects. So a TENS unit looks like this. It's a very small device, it's battery operated, and when you get a TENS unit, you see several things. You see the TENS unit itself, the electrodes, and then the cords. So I'm going to be my own patient here, as many people are, and they have to put it on themselves. So I'm going to pretend that my elbow is in severe pain from a past injury. So what you're going to want to do is you're going to want to connect your cord to your electrodes. By connecting the cord to the electrodes first, it makes it much easier to attach to your body than if you're trying to attach the cord to an electrode in an awkward position. So you want to grab the electrodes, which are sticky on one side, and you want to place them so that they surround the area that is hurt. You want to put them on either side, ensuring again that you don't go across the heart or across the brain. You would then insert your end of the cord into the TENS unit itself and turn it on. So the TENS unit does not immediately begin with electricity. It will give you a moment to get yourself ready, and then you can start it by yourself. So the TENS unit has many different modes. You can pulse it, or you can have it run at a constant rate. However, many healthcare professionals recommend that you do not leave a constant stream of electricity going, as it does not help dull pain as well as pulses. So another thing that's interesting about TENS machines is that they have dials that are patient controlled, because you want the patient to be able to control how much power gets put into them, because you want the patient to push themselves to their limits of comfort. However, you do not want them to have pain. So you want them to begin turning the dial until they begin to feel a slight tingling sensation. It's almost like ants running up your arm or wherever you are injured. So I just started feeling it now. However, I would want to turn it up. You want to make sure that you do not have muscle spasms or anything like that. However, you will begin to feel as you do it that your arm becomes numb in that spot. And I can tell that if I had pain in my arm, that it would not hurt so much right now. So with the TENS machine, you can set a timer, and it can be used for a certain duration of time and then go off on its own, or you can manually control when to turn it on and turn it off. One important factor is that patients will build up a resistance over time. If they continue using the device, eventually they will have to change how much power gets put into it as they use it more and more, because your body gets used to it and then the sensation doesn't occur. So thank you very much for watching, and I hope you learned about TENS units.